today to conduct the business of the District of Chetwynd, we do so knowing that we are privileged to serve the citizens of this community, and we shall endeavor to conduct our business in their best interests. Thank you.
Yep. Thank you, Deanne. Oh, Carol. All right. Any new business prior to adoption of the agenda? Council?
Yeah, I'd like to bring up the doctor issue, if that's not a problem.
Doctor?
Issue or the lack thereof.
Any other councillors? Okay, the mayor's got on the same subject or a different subject or just a subject at all is with Northern Health, letter to the public. Just I want to throw it out there to council. Okay, any more new business?
Who's on the phone? Like, who's that 1-250-640-5542?
Where do you see that?
But there's on the bottom of my screen, I have a phone number phoning in. I'm just wondering who it is.
Oh, I see that.
I have it too.
Yep.
Must be a member of the public.
Okay, well, they're on mute, and I guess if they want to speak at any time, they will unmute. Right?
Okay. Okay, adoption of the agenda.
I would make that motion that we adopt the agenda with the new addition of lack of doctors and Northern Health letter to the public. And the meeting is being conducted via Zoom due to the prevalence of COVID-19 and the provincial state of emergency.
I'll second that.
Okay, any discussion on the agenda? All those in favor? Okay, carried. So minutes from the meeting on October 5th, 2020. Any
So moved.
comments or discussion on October 5th? Laura?
I was just wondering if we found out any information that I asked about for the Chetwynd Temple Society.
Yes. Carol?
Yes, we did actually. Kevin and I looked into that, and we discovered that your question about the Elks, that they did have a permissive tax exemption up until the property was sold in 2007, I believe. Correct me if I'm wrong, Kevin. And that Kevin had sent a survey to the Chetwynd Temple Society, and they returned it today, actually fully filled out. So they actually qualify as a not-for-profit organization.
So then does that mean that we're going to move them down to the next level because they're not under the churches?
Kevin, did you want to answer that?
We can move it down. They do qualify for a tax exemption. So if you wanted, you could make the amendment to move them down to the other section, or we can leave them there and I'll address it at next year's bylaw, however council wishes to deal with it.
Yeah, that's fine with me. I was just curious if it made a difference.
No.
Okay, that was my question. Thank you.
Yeah. Thank
So
you.
we're just going to leave it to staff, Laura, and
Yeah, they can deal with the next year if we have to move it.
okay. Okay, yeah, any more questions on October 5th minutes? Okay. Need to accept the minutes for October 5th, 2020.
You need a seconder? I will second that.
Okay. Okay, good. All those in favor? Carried. So we had a delegation and she was busy as as we know, today has been a pretty difficult day on the road. So with her calling in and saying she cannot make it, so Carol will get back to us on the next time she will be able to address council and introduce herself. So I think it's Wahanasi Anton Stevens, I believe. So she will come and correct me on her name. So I'm sure we will all have a go at it. So yeah, I was looking forward to meeting her. So I will reach out to her myself as mayor and ask her a few questions, and Carol will organize another time when we could meet her in council. And okay, we will continue with the bylaws. B1, District of Chetwynd Tax Exemption Bylaw 1123/2020 requires adoption.
Motion to adopt.
Second.
Okay, play second. Discussion. Okay, all those in favor? Carried. B2, District of Chetwynd Zoning Amendment Bylaw number 1124/2020, 5244 42nd Northeast requires third reading and adoption.
I'd like to be excused due to a conflict of interest, please.
You excuse, Mel?
Okay.
I'll text you, Mel, when we come back.
Thanks, Rochelle.
Yep.
District of Chetwynd Zoning Amendment Bylaw number 1124/2020 requires third reading and adoption.
I'll move third reading and adoption.
I'll second that.
Okay, any discussion? All those in favor? Carried.
Okay, sorry, just give me 2 seconds.
Yep, you bet. Okay, moving on. Committee reports. The regional district waste bylaw. Did you get any information yet, Mel, on that? What they're proposing with the new plan to send to the government?
No, I did not. No,
I will talk to Dan. I will be seeing Dan on Wednesday, and I'll see if I can't get some information out to you. It's a plan on what we are going to do with our solid waste in the area. So that concerns us because of our landfill, probably 8 years, I figure, and there might be another one. So they're trying to work on it. So hopefully when I get Dan to send you a report, Mel will bring a little report to the council.
Yeah, you bet. We didn't have a solid waste committee meeting at the beginning of October here, but I'll be for sure attending the one in beginning in November. So.
Okay.
Okay.
Any other reports?
Just a quick update on the Chatland Communication Society. There's been a lot of revamping and a lot of updating for financial records and service to the towers and inspections, and lots going on. I guess if there was any specific questions I could answer, but things are they're very organized, but up in the air and disorganized. I don't know how quite to explain it, but kind of reworking the vision of the Chatland Communication Society. The last time the scope was really presented, it was back in the late 70s, maybe early 80s, and they're still very much so a need, but it's a different view on what's needed. So there's a lot of people working very hard on it, and committee has been tasked that they can act fast without having approval from the entire board on certain matters, but eventually it's needed. They are working very hard to get things definitely in line. Very healthy. Bottom line is good, but just a lot of work going on there. And I can try to answer anything more specific. I don't know what more to say, but it's going well. Mm-hmm. Rochelle?
I have a question, Clay. Are they still doing the student training and everything like that? Are they still, or because of COVID, they're not having students come in, or what's that looking like?
COVID hasn't disrupted things too much. There's one person on the air at a time, so there hasn't been students in there for a little while. The radio station is functioning as it always has. TV is a little bit different. I mean, as you know, right now TV is not at the council meetings,
Right.
and so that's different that way.
Are they going to try to remain a training facility?
Well, as far as the radio station goes, we get the kids right out of school.
Okay, right.
Yeah, and it's an attractive because there's places for them to stay. The apartment is part of their pay, and that's where they have to stay when they come. So the radio station hasn't much changed. So the operations of the Chet TV and Peace FM and the thrift store is actually included in this too.
Oh, okay.
That hasn't changed. It's more so the view on what the Chetwynd Communication Society is serving to the districts of Chetwynd and the Peace Regional District. And back in the 70s and 80s, it was all about having the TV stations on the antennas, the old
rabbit ears.
Yeah, the rabbit ears. Yeah, and so that was the gist of it back then. So of course needs have changed over time, but part of the Chetwynd Communication Society is the emergency broadcast system too.
Right.
And then just looking at the Chet TV, and there's actually been a consultant come in just to give some tips and pointers on ways to streamline and the best use of our resources.
Oh, good.
So it's a pretty confusing time right now. Like Leo Sobolski, he ran that from its inception, right?
Inception, exactly.
Exactly. So it's a pretty confusing time, and Leo did a great job. But I mean, I think that we all appreciate Leo, and he did a wonderful job. But to pass down Leo's way of doing things to somebody else is almost impossible. So we got some people working very hard at it, some really good people working very hard and moving forward with it.
That's good to know, Clay. Thanks.
Any more questions? Yep, thank you for that. And I'm glad to hear that it's almost impossible. Almost. So any more reports? You good? Okay, thank you, Clay. Discussion items. Email from the Peace River Regional District, October 2nd, zoning bylaw number 1343, 2001, housekeeping amendment. I believe they're just trying to clean up some of the stuff that's been there for a while. So if you have read it and have any questions, I think they just were asking for our opinion or our comment on some of the matters in these bylaws. So does anybody have any comments or stuff for the PRRD on these zoning bylaws?
I just have a quick question.
Yes.
Do either you or Mel, because you sit on that committee, do you have any concerns over this or something that we should be aware of?
Nope. My concern, it's not a concern, but it's just my view of it is that some of the stuff's been sitting there just like you have stuff in the attic, And this is what I refer this to as something that's been there and hasn't been changed. And now we're moving forward. And just like Desiree found some stuff that we have to clean up in our books and
Right.
how we're clean, that's what they're doing here.
So there's no concerns.
Nope.
Okay, Mel?
Nope.
Nope.
Okay.
Then I would make the motion to receive.
Second.
Okay. Jocelyn? Okay. Great. So let's see, any correspondence? Information items? I1 to I8. Does anybody see anything in there that they want to bring forward?
I I'm not sure which one it was.
Okay.
I'm sure, I just wanted to know if you guys noticed the new president for the FCM is now a counselor from Prince George.
Awesome.
Yeah, it is awesome to see.
That is just amazing. That's all. That's so good for us.
Yeah, it is.
Yeah.
I'll make a motion to receive.
I'll second.
Yeah, motion from I1 to I8 to be received.
Yes.
Yep, and I'll second.
Okay, all those, any more discussion on that? Good. Okay, all those in favor to receive, yep. Good. Carried. Reports for action, RA1, Investment in Canada Infrastructure Program, Rural and Northern Communities Infrastructure Fund Application.
I can make that recommendation that council authorize staff to submit an application for fund granting for the 51st Street Northwest Road reconstruction project through the Investing in Canada Infrastructure Program, Rural and Northern Communities, and that council support the project and commit to its share of $300,000 of the project, as well as the potential cost overruns.
Second,
I would second that.
okay, discussion.
I would like to know potential cost overruns. I don't know. I think we've always been directed that we don't build projects based on grants. So, and 300,000 isn't a lot, but I guess it's the potential cost of overruns that has me concerned. Thank you, Carol.
I was just going to say that I know it sounds alarming, but the UBCM grants want this on there in the resolution that they accept for the grant application. So they're just asking for a commitment for if we did get into cost overruns that we know that we would have to pay that. And that's always been the case. If ever we did a project and we ran into cost overruns, we would never go to UBCM and say, can you please pay the overages on this? We just make sure it doesn't go over.
Okay, thank you.
Welcome.
And then is that
Go ahead,
two
Mel.
different? Can I go ahead?
Yes, go ahead. Yeah.
Two different grants then, Carol? Like one for 300,000 and one for 1,500 or 1.5 million and 300,000. Is that two different grants?
No, it's the 300,000 would be the district's portion. It's a matching grant, so they would pay the most, and then there's a little bit of it there that we've actually got in our capital infrastructure renewal plan to pay if we should get the grant.
Pardon me, I have to just clean my glasses and get a little closer to the screen. I didn't see the ineligible. I'm
Oh, no.
sorry. Thanks.
Okay, good. Any more questions or discussion on Clay?
Is this one of the jobs that's grant dependent?
Yes.
When will we know?
Well, we have it in our infrastructure renewal plan to start next year. So, and we've already got some design work done on it. So we would probably know in the new year, I believe.
So design work, sorry, Clay, did you have any more?
Nope. No.
Okay,
Thank you.
the design work, is that included in our 300 or is that paid for through this past year?
I believe the design work that we've got done is already paid for.
Okay, thank you.
Welcome.
Any more discussion? Okay. We have motion. All those in favor? Okay, carried. Okay, let's move on to new business. Mel, you've got the northern, our doctor issue.
Yeah, once again, we're quite low on doctors. First off, I just want to make it perfectly clear that I'm not aiming anything at the hospital staff. I think the maintenance staff, the cleaning staff, the kitchen staff, the doctors and nurses and the front end staff are doing their job well. I don't think that's where we're being let down whatsoever. Also, we're currently experiencing doctor shortages again, in my personal opinion, due to poor foresight of Northern Health. We were told we needed a clinic. The community rallied and built one. Now you call the clinic, and I've had more than one person tell me that they tell you to call the clinic in Dawson. We were told they need help with housing. We're basically subsidizing housing for Northern Health as well at our taxpayers' expense. And yet Northern Health still can't get us doctors here on a permanent basis or on a continuous basis. We've had many emergency room closures, which taxes our ambulance service to the limit. There seems to be no end of the excuses we get or the empty promises, for that matter, from Northern Health. I think from here on in, we have to, any time we're communicating, I don't think we should be communicating with Northern Health. I think we should be communicating directly with the Federal Minister of Health, the Provincial Minister of Health. We should be CCing Mike Bernier, Bob Zimmer, the Premier, the Prime Minister, federal health critics, provincial health critics, and any newspaper that will listen to it. I think we're pretty much. I don't know where to go from here. You guys have been so diplomatic with this. Our staff and and council has been so diplomatic with it. I think the time for diplomacy is done. That's it.
Okay, yeah, Rochelle.
I have a little bit more to.
Yeah, let's
sorry.
get Rochelle, Councillor Disher first, and then we'll go to you. Okay, Rochelle.
Okay, so Mel, you must have been reading my mind today, and I have to say I've been out of town for a little while, but I've heard the same. I have a large family, and why are we getting referred to Dawson Creek? And it's beyond me. We put our heart and soul into that clinic, and Northern Health was behind us and was the driver in this. We did our success story at UBCM. We were the highlight. Chetwynd was on the map. And now all of a sudden, everything has just gone to, it's in a handbasket somewhere else. And it's very disheartening and it's disappointing. I think we need to have these conversations sooner than later, because it's, and I agree, Mel, and I know where your diplomacy is at, because I've been with you when we've been with the deputy ministers, and I understand your frustration. I don't know what the solution is, but I do know that something has got to be done, and I don't know that if it's in Northern Health's hands anymore, but they always talk to us about retention. Well, we have a doctor that wants to stay, but this doctor doesn't have. Anyway, I'm not going to go there. Anyway, I don't know what the answer is, but I think you've nailed it, Mel, and I think we need to move beyond the health authorities. I think we need to go just one step ahead. And if we can figure out that how we're going to do that, Mr. Mayor and Carol, then I think that those are the steps and the priorities we have to take.
Just for, I've done a little bit of research on this as well. It's really been bothering me the last week.
Okay, Mel, hold that thought.
Oh,
Mel,
right,
hold that
right.
thought. We have
Sorry.
Councillor Disher.
Okay.
Okay, go ahead, Jocelyn.
Okay, no, I was just going to add a little bit more to what Mel had said about our actual working staff up at the hospital. After spending 5 weeks up there with my mother-in-law, I really saw how hard those people work. There was one nurse that I met in 5 weeks that actually was from Chetwynd. And I know that we have licensed nurses here, and I don't understand why they're not working. And one night there was 2 nurses on, and they were running so hard, they were literally sweating. It was that bad. I was very lucky. Our family was very lucky. We were given special status to go in and help with our mother-in-law, but not very many people are. And we had to really fight for that. So, I mean, I know COVID and the rules and everything else puts another perspective into everything. But I have to say, the nurses up there, the doctors, the kitchen, the housekeeping, every one of those people up there was working hard. And Victoria was running her butt off when that boiler didn't work for 4 days and everybody was freezing up there. So my thing is, can we not sue Northern Health? Have they not broken the contract? Can we not get our lawyers on this? Because, I mean, with the election coming up, the ministers aren't doing anything. And I mean, I realize it's only a week away now, but they're not doing anything.
Okay, that's good, Councillor. You're done? Okay, Mel.
Okay, so the Canada Health Act specifically states that the act sets out the primary objective of Canadian healthcare policy, which is to protect, promote, and restore the physical and mental well-being of residents of Canada, and to facilitate the reasonable access to healthcare services without financial or other barriers. I mean, I don't think they're fulfilling the Canadian Health Act even. That's my personal opinion, though.
Clay?
You're right, Mel. We get the same song and dance from Northern Health all the time, and I think that they're going to find ways that they're meeting this, they're meeting that, and that's their same song and dance is to outline everything good that they're doing. The problem is that they might be checking off the list, but what they're doing isn't meeting the needs of Chetwynd residents. And that's the bottom line of it. And the people that we have here are great. I mean, we'd be in much dire straits if they didn't do what they do. And yeah, the nurses up at the hospital are amazing. Like who can pull off what they do with the workload they're given is incredible. And nobody should be asked to do that. I think that
With a smile.
I think, and they're doing it for the right reasons. They're doing it to help people. And there's a certain doctor in Fort St. John that's responsible for the contracts in Chetwynd that at some point she got into medicine to help people. And I'd like to know when that changed, when it came to balancing some budget or whatnot, and how they can leave us in the situation that they've left us. And feel okay about it, and yet try to defend what they've done when this is the state that we're in. And I think that we need to ask those questions of Dr. Elric directly, and not let her do her song and dances to everything they're doing, because what they're doing is failing us big time, huge. And I don't care what they say, it is. And the council today, and it was before me, but they did the right thing by building that clinic. They hired a consultant to come to town, take a look at our situation, and told us that this would help. And we take the advice of professionals when we pay for it. We'd be crazy not to. So that was the right decision. It was obviously executed very poorly. And Mel, I agree, the time to be completely diplomatic, I think, is over. But I still think we got to take a look at where we are, where we want to go, and how we're going to get there. And the fact of the matter is that ministers don't deliver health care. All the ministers are going to do, this election is going to get done And all they're going to do is start strategizing as to how to either stay in power or get power back. And this is what politicians do. And that's what the ministers are going to do. It's the assistant deputy ministers that survive the elections and carry it on. And it's going to be the Northern Health region that does it. So as far as talking to the politicians go, I'm sorry, but we've seen what it is. It's just a matter of getting control. But I think we're taking the right route with talking to Dr. Ulrich in November. And we just got to be forceful and not let them do their thing.
Is that going to be soon enough? We're talking November 17th or something like that, aren't we?
That's all we got.
Carol, that's correct, 17th?
That's correct. November 17th at 2 o'clock.
Okay, any other counselor? Laura? You're on mute. Laura?
There you go. How can you hear me?
No, we got you.
No, I agree. I mean, we are at a place in our community where we shouldn't be. Because Clay is right. We worked hard getting that medical clinic up to where we needed it to be for the people of the community. The only thing I can say is that I went on Northern Health site. You know, we're not the only ones. There's 54 positions in Northern Health alone looking for doctors and 300 in the province. So saying that, I mean, if we go into Northern Health meeting with them and right away start talking and getting mad at them saying you need to get us doctors, fortunately, they can't pull doctors out of their butt. I think we got a good line on a couple. I mean, the ones that we've taken out for supper, and I'm really praying that they come from Alberta. But I know we have to, I think meeting with Northern Health is the way that we have to do it. And that's all I really have to say.
I think they just got to.
You go Mel and then Clay.
All they have to do is sign the check. That's all they have to do. It's pretty cut and dried. I don't care what anybody says.
Okay, well, can I respond to that?
Yes, go ahead.
The thing is, though, cutting the check for what, Mel? Like, yes, they can cut a check for a doctor, but is that the answer? Like, I mean, it's a business. You know how to run a business. You're not going to just give every doctor what they want. I mean, it's diplomatic. They're politicians, or you know what I mean? It's still a business to Northern Health.
Well, yeah, they're playing with business. Like, this isn't government. Isn't a business. If it was a business, there wouldn't be a government, because government cannot run a business. That's
We run a business. I mean, the government, the municipal is a business. We run it as a business.
It's a losing business. Like, if we're on the stock market, it would be tanked. And that's nothing derogatory to anybody. I mean, government cannot run a business. They just.
You got 2 more words, and we're going to go to Clay. We're talking. We're moving away from our subject of our healthcare here. Clay.
I think Laura's right. We still need to work with Northern Health. Nobody's going to bury them. We're not going to find a politician federally or provincially that's going to back us to bury Northern Health. We still need to work with them. But there's 2 names that I continue to hear coming up steady, and I don't know. Like, I mean, where there's smoke, there's fire. And the bottom line is that we've got a doctor in town that wants to stay. He doesn't want to move, and he can't settle on a contract. And I keep on saying that if we can't retain a doctor that wants to stay here more than anything else, we haven't got a hope on attracting anybody.
Rochelle?
And exactly. And they always go back to Northern Health, always goes back to, we need to do more for retention. Well, we've retained. Now you need to do your part, Northern Health. And, but I forgot what I was going to say prior to that, but yes, no, you're right, Clay. But I think our conversations with Northern Health have fallen on deaf ears. I have been on council since 2011, and I don't see what's changed other than this amazing clinic that was the first one in British Columbia, full of 5 doctors, and it was working out perfectly, and now it's not. So I don't know what changed, but they don't seem to be in a panic to get it filled.
Janet, did you have anything?
Yeah, I'm not sure if where this came from. Sorry, I'm just gonna say that there was something about, you know, Northern Health wanted to now charge the doctors for use of the clinic. That's not, that doesn't help us. So, you know, we're in this situation now. We have that against us. You know, our current doctor is going to support more doctors coming here. Well, now, is he really? Because he's not working with Northern Health. So how is he going to support them, which supports us?
One thing prior
and then these are the hard questions that I would like to ask.
Yeah, Janet, one thing maybe we should fact check our statements when we do talk about if that's true, then we should have it somewhere that is correct. So if it's somebody telling you or you've read it somewhere, we should have that in front of us prior to making that kind of statement. True? Yes? No?
Oh yeah, sorry. Yeah. I mean, absolutely. And I will follow up with you on that.
If you can follow that up for me, that'll be great, and for council. Laura, then Clay.
As far as I understand, Dr. Banas is still staying, right? Like, he's not going anywhere. He's just doing it privately now. Did you say, Clay, that he was leaving?
Correct.
No.
Oh, okay.
You're correct. Clay?
Just from the public meeting that we had with Northern Health with Angela DeSmit and Peter Martin, it struck me that Dr. Banas was having a difficult time finalizing a contract with Northern Health. That seemed very obvious to me. That's where my comments are coming from. But I do think that if we start to, and I've said in the emails too, if we start to make it look as if we're negotiating on behalf of the doctors, that's not going to get us anywhere with Northern Health. We got to go in there with the position that we have a population in Chetwynd, a lot of young children and a lot of older senior citizens that aren't getting quality health care. And some are moving away just because they're closer to healthcare. So this is a big deal. Like, it's not a big deal in summertime when a trip to Dawson isn't bad. But now, you know, if they got to make an appointment 2 weeks from now in Dawson Creek, they don't know what the roads are going to be like. And to have to travel an hour to go and see a doctor when we got this clinic right here in town and a hospital, it's ridiculous. It's not something our citizens should have to do. And they elected us to speak on their behalf, and it's their behalf we should be speaking on when we talk to Northern Health, and not so much the doctors, in my opinion.
Yes, I believe you're stating stuff that we all know, and healthcare, what we're discussing now, and that's true. So anyway, is there any more on doctor issue? Okay, moving forward. Is any of the staff, like you're hearing this, and do you have an opinion? Because I'm asking. Okay, I've asked, and okay, we'll move on to the second business, new business is a letter. We just went over items that we've discussed with the issue on doctors. So I guess the gauntlet was put in my name, the mayor's name, and CAO. So what was proposed to our CAO by the mayor was a letter put in all the facts that we've been discussing here today. And I've instructed the CAO to get a hold of our lawyers, Lidstone and Co., to give us some advice. Not that we would take it into the point that it's all lawyer talk. It has to come from us as mayor and council to the point that we are needing the healthcare that mandated by federal and provincial governments. So we will put something together. I've already had a talk with Carol end of last week and trying to get it out before the provincial election, which is right around the corner, which doesn't give us very much time. But one of the things that I wanted to do was get it out there prior to the election and have another one after the election. And then maybe if we have to follow up, we have to do it quickly and not wait 2 weeks for a response. I think our response should be another letter drafted saying this is the first one, second one, and third, and if we need to continue. Because unfortunately that Northern Health thinks that they are the all that ends all, and that's the way I look at it. And when I first got into the seat as mayor, it seemed like we were doing okay until we met with Northern Health, and it seemed like it was kind of an uphill battle. And Chetwynd doing their part by building us a clinic to make sure that we had the facility, and we do, and we're waiting, and we waited, and then now every time we wait, it's always a closure and emergency. Oh, where's the doctor? It's been 2 years and we've been going through these locums. Sometimes you don't even know where the doctors are coming from. It's been like that for a little while. So I believe that you've left it with myself and Carol, and we will draft up a letter with some help from our legal team so that we can put something out there, because we shouldn't be counting on Angela or Dr. Templeton and possibly even Kathy Eldridge. There is a board that Kathy is the head of. So we need to address this either to the board, to Kathy, to the minister. So we will get some stuff out there for council to present it to the public, and we will find out we will ask which public, paper, media, television, radio, whatever broadcasting system that we need to entertain ourselves into the fact that we get our message out. It's a message of what we've heard today from council and press on some of the points. So that letter is going to be here. Well, hopefully we hear from our lawyers so that we can draft something up, because we don't want to be hurtful, like hurting our own chances to get doctors, but we have no doctors. That's what I say right now. We don't. Totally disappointed in what Northern Health tries to achieve by pointing out that, oh, we're doing this and we're doing that. I've heard that for 2 years, and one of the doctors wanted to stay, and they didn't sign them. So for whatever reason, that's their business, but our business is take care of our citizens, and that's the way it should be, and that's the way it's going to be. So we must take care of our citizens first, because we are citizens too. We live here in Chetwynd. We go to the doctors. Hopefully we go to the doctors here in the next little while. Like when I say while, 5, 10 years, that's family doctor who we need here in Chetwynd. So with the letter, if you have any questions once we draft it, it has to be done in the next little while. Hopefully if Lidstone and Company doesn't get back to me by tomorrow afternoon, like 1 o'clock, I will be contacting them, myself and Carol, and discussing the matter, because it's urgent that we talk to them, and then it's urgent that we get a letter out by hopefully I'm taking timeline Thursday, so we only got a couple days here. Anything on the letter and what mayor and CAO might have to do going forward in the next couple of days? We only got about a window of about 48 hours here we're talking about here. So, you know, this discussion, I believe, could have happened a month ago, 2 years ago, but it's happening today. It's happening today so that we can move forward. And we're not going to be able to stand in quicksand, and that's where we are. We move a little bit, we get a little deeper, and pretty soon we're going to be up past our nose. Laura?
So what are you asking our lawyers for? Like, what do you
Just make
advise
sure
you want?
we're not saying stuff or putting stuff in our letter that would harm uh, ourselves as council or mayor.
Oh, I see. Okay.
Yeah. Clay?
Good call on that, Mayor. Thank you for protecting all of us with that. I think it's time and money well spent.
Yeah. So any more discussion? And let me and Carol take a look at it, and whatever staff members we need to employ on our letter. So Carol, do we need anything from council in form of any resolution, or should we just go ahead and say this is we're a letter coming from the mayor, or how should we present it?
I think a motion would be nice. If council just wants to give us some direction to draft a letter and present it at those forums that you mentioned, the minister, Kathy Ulrich, the media.
I'll make the motion to that effect.
I will second that. And I just have,
Discussion? Yeah.
okay. And based on what you've heard here tonight, is it possible that we can get a copy before it goes out, just for our perusal?
Sure, absolutely.
Thank you.
Is that good, council? Okay, all those in favor? Carried. Okay, thank you for that. Any questions from the public? Did the public leave? I don't see the number on there. Yep, I think public has left. I think that the number is 250-645542. I don't see it on here. Okay, adjournment.
So moved.
Okay,
Second.
done. We are adjourned.
Good night, everyone.
Yeah.
Thank
Hey.
you.
Thank you for that, council.
Good
Good
night.
night.
Night.